Tara Brown. I'm a registered nurse and I'm currently in the MSN program at Jacksonville State University. Last semester and this semester I've been working on an educational project on an intellectual disability and behavioral and lifestyle coping strategies in Pisgah, Alabama. So for mental health, this is one of the most untreated diseases in the world. One that interests me is intellectual disability. A lot of people are not aware of what intellectual disability is, and I believe that everyone should have some knowledge of this disease process. So intellectual disability affects the neurodevelopment of individuals. This means, intellectual disability means that the individual has an IQ below 70, and to be a candidate for Medicaid services, you would have had to have been diagnosed by the age of 18. National statistics for ID. There are approximately 200 million people in the world who have ID. This is approximately 2.6 of the population. Regional is 4.92 million in the U.S., and this is about 17% of the population. And local is 572,102 individuals, and this is about 15.5% of the population. So the identified problem for intellectual disability that I'm focused on is behavioral and lifestyle coping strategies. This affects their health due to communication barriers or inability to perform ADLs, inability to give medication, and inability to transport themselves. Most individuals who are at risk are individuals who have Down syndrome, fetal alcohol syndrome, Fragile X syndrome, genetic conditions, birth defects, and infections. So some of the behavioral and lifestyle coping strategies that we talked about in this project are deep breathing techniques, redirection by the family or caregiver, staying active, communicating the issue or the problem, and isolation or removing the individual from the situation. And I've learned that a lot of times if you remove them, it does help de-escalate the situation. So review of literature, one article is behavioral, psychiatric, and psychosocial factors associated with aggressive behavior in adults with ID. This review was conducted to determine the association between individuals who are affected with ID, behavioral, psychiatric, and psychosocial behaviors. There were 38 studies, and 11 of those 38 studies presented behavioral, psychiatric, and psychosocial factors. So the next article is behavioral skills training for family caregivers of the people with ID or DD. And this is a systematic review of literature. It talks about how the individuals lack self-care skills. The family caregiver may need to step in and take care of the individual. This can sometimes be a full-time job for the family. They usually experience most behavioral issues by the individual, and it talks about how family members and caregivers may benefit from behavior management. This helps de-escalate the individual or the behaviors that the individual may present. So the next review of literature is strategies for enhanced social skills of individuals with ID. This talks about social skills, and so individuals with social skills or limited social skills are at risk for increased behaviors and self-injurious behaviors. So this study shows the intervention is adequate. So if you improve their social skills, this can potentially decrease behaviors and self-injurious behaviors. So the next review of literature is developmental delays in socio-emotional brain functions in persons with ID. There are different types, and so ID or individuals with ID may also have DD delays, which is developmental delays. And this talks about how it focuses on the knowledge from developmental neuroscience in persons who are affected with ID. So if the individual understands how people with ID and DD function in society, this enables the person to participate in all aspects of their lives. The last article is work-related stress and well-being of direct care workers in ID services. So serving individuals with ID or any disease process, the caregiver can get burnout. And this article focuses on protecting the well-being of the care workers, healthcare workers. And it talks about how workplace demands and lack of support increases the stress, which increases caregiver burnout. So needs assessment for Pisgah Medical Clinic. This is my gap analysis, and it just shows that the nurses and the nurses or healthcare providers need more education on ID. They're not aware of what ID is, the NDP program, home community-based settings rule. So the desired state is to educate them in that. And I did that. I did this gap analysis by interviewing the staff at Pisgah Medical Clinic. So the SWOT analysis for Pisgah, Alabama talks about the strengths of having Pisgah Medical Clinic, and they accept patients who have Medicaid and Medicare. Some people don't accept individuals who have Medicaid, and that's a strength we have. Weaknesses, I feel like they need more time for their assessment. It's difficult to diagnose patients with ID due to communication issues. Some of the opportunities, they provide psychiatric and nurse practitioner and family nurse practitioner. They're the only ones within miles due to this being such a rural area. Threats, I would say individuals, I would say Pisgah Medical Clinic has a small area in the clinic, and this can increase the risk for individuals with ID to have behavioral issues as well. So windshield survey, I noticed that in Pisgah, Alabama, the houses are worn, large overgrown, limited gathering places, limited resources, businesses, healthcare services, places for advertising, and farming is the major business here in this area. So key leader and informant interviews, I interviewed doctors, nurse practitioners, social services, and all these individuals or healthcare providers agree that there are not enough services in this area for ID individuals and not enough healthcare practitioners or doctors. Nursing theories that would support the intervention or strategies for ID, population, and behavior is Dorothy E. Johnson's health and behavioral theory. She talked about two major systems in the body, the medicine focused on biological system and nursing focused on behavioral. The patient's behavior may be directly influenced by environment or events that occur in the environment. Goal is to maintain equilibrium in the patient, and her 4 goals were whose behavior is in proportion to social demands, who can modify his behavior to support biological imperatives, who can fully benefit during illness from the physician's knowledge and skill, and whose behavior does not give evidence of unnecessary trauma and consequently of illness. So environmental, individual, and agent factors that affect behaviors. Environmental exposure to substances, alcohol abuse while in utero, traumatic brain injuries, genetics. Individuals can increase their risk for behaviors by using alcohol and substances, lack of communication. Primary, secondary, and tertiary prevention. Primary is going to be to try to prevent the behavior by talking to them or redirecting them. Secondary is a behavior support plan. So a behavior support plan shows what steps to follow to de-escalate the behavior. And tertiary is you've exhausted all your resources and you may have to call law enforcement or somebody to step in and help you. The education project plan, individuals educated them at the clinic, community at the health fair, at the pavilion, caregiver at the clinic, and family at the clinic. Let's see. There are 3 community diagnoses: lack of education, lack of resources, lack of education being the primary community diagnosis. The evidence-based educational project plan, we focus on education and using the 5 sub-roles of APHN to promote Healthy People 2030. Those 5 sub-roles is researcher, clinician, educator, collaborator, consultant, advocate, or change agent. And as a nurse, you have to act as all of these to promote healthy living in individuals. So my project objectives were families will explain one way of de-escalating behaviors in individuals who are affected by ID. Staff will demonstrate the correct way of redirecting the individual who's affected by ID. And people in the community will explain one simple way of calming individuals who are affected by ID to de-escalate non-common behavior. So my project resources were internet, Stevenson Park Pavilion, and information from leaders in the community. So the internet cost me about $75, and the pavilion cost pavilion and supplies $325. So in September, I educated the staff and individuals. September 7th. September the 8th, I did a health fair. September the 21st, I did education with more families and more staff. So some of the barriers that I noticed were communication, funds, and limited resources. Some of the challenges, some individuals are nonverbal or unable to communicate. Pisgah has limited resources for employment and is at risk for poverty. And they have limited resources in all areas, such as healthcare, transportation, etc. So I educated the family, the community, and the staff. These were all successful. Everyone learned a coping strategy in this educational sessions. Lectured the individuals, staff, families, and community. I asked everyone questions and answered everyone's questions. So the individuals talked about the coping skills they had learned during the project. Family and staff talked about and described coping skills they had learned, and everyone in the community who attended the health fair talked about coping skills they had learned during the lesson. So let's see. There were 2 autistic individuals that attended that were nonverbal, and they came and had to immediately leave due to being overstimulated. One went to the park and one went to the car and just covered his head up. Some of the individuals couldn't read, so we read to them. This project was a success. Everyone talked as if they understood the meaning of ID, and they talked about the behavior skills they had learned. Coping skills we talked about, and that they said that they learned about was listening, speaking in low tone voice, ensuring understanding, isolation, removing individuals from the situation, the behavioral support plan. What would I change if I did this project? I would have started setting up locations sooner. There was more places that I could have used, but I felt like I had run out of time. And I know that after talking to more people during this process, it would have been cheaper and more convenient. But at the time, I just did what was easily available. So future recommendations is get your priorities in order. Do you really want to do this? Because it is very, very stressful and time consuming. And I would recommend anyone who has children or plans to have children do this before you have children, because I feel like I had no time with my children. Let's see, just make sure everything's in order. This was a learning process, very time consuming, very difficult, very stressful, but it was all worth it and was all meaningful. I learned a lot, and I feel like I can use what I learned to serve the individuals that I serve with more quality of care or better quality of care than than I feel like they received in the past. And these are my references. If you want to look at those, you just scan the QR code. And I just want to say thank you for all listening, and I wish you luck on your journey through this process.